on my behalf and on the behalf of the organizing committee of the webinar. I request Dr. Barinder Uppal ma'am, Professor and Head of the department, to introduce our guest speaker of the day and also welcome her and the participants. Madam Uppal, please.
Thank you, Dr. Pathak. Good afternoon, everyone. Dear participants, with the guidance of our worthy Vice Chancellor, Sir Dr. Inderjeet Singh, and Dean of our college, Dr. S.P.S. Human, we are organizing a national webinar on the topic Topographic Anatomy of Abdomen of Bovines in relation to clinical interventions under the aegis of Institutional Development Plan, which is an ICR project of University Veterinary and Animal Sciences University, Ghana. I welcome you all in this session. As you know, anatomy is known to be a basic subject, but it is the pillar of all clinical and paraclinical subjects. Knowledge of anatomy is essential for physical examination of disease, diagnosis, and any clinical intervention, and thus it plays a very important role in improving the clinical skills of veterinarians. All the modern radiodiagnostic techniques like ultrasonography, MRI, CT scans, X-rays, which reveals information about inside of living body, also requires a thorough knowledge of anatomy for interpretation of images. We know that in the animal body, the abdominal cavity is the largest cavity, and the knowledge of topographical relations of different organs in the cavity is very useful in clinical and surgical procedures. Keeping in view the importance of this topic, so this national webinar is being organized, and we have invited Dr. Archana Pathak to deliver this talk. Dr. Archana Pathak is Professor of Veterinary Anatomy at College of Veterinary Science, Mathura. She did her BVSc, MVSc, and PhD from College of Veterinary Science, Palampur. She started her career as Assistant Professor in Palampur in 1998. Then she joined Veterinary College, Jammu in 2005 as Associate Professor. And since 2009, she is acting as Professor at COVS Mathura. She has 22 years of experience in teaching and research. She has published more than 100 research papers in reputed journals, won many awards at professional scientific societies conferences, and delivered many lectures in short courses, symposia, summer schools, training program, etc. So keeping in view the expertization of Dr. Archana in this subject, we have invited her to deliver a talk on topographic anatomy of abdomen of bovines in relation to clinical interventions. I hope this lecture will be highly useful to our students and clinicians in their professional life. Now I invite Dr. Dindra Pathak to organize this talk, please. Thank you.
Thank you, Dr. Uppal.
Dr. Pathak, please unmute yourself.
Now I request our guest of the day, Madam Pathak, to enlighten us on the topic. And I also request the participants to post their queries, if any, in the chat box, which can be taken up at the end of the talk by our expert speaker. Madam Pathak, you can go ahead and share your screen, please.
Are you able to see my screen? I have shared my screen. Dr. Pathak, are you able to?
I'll just.
Is it sharing?
Yes, ma'am. Yes, ma'am. You
Is
can
it
go
okay?
ahead. Yes, you can go ahead, ma'am.
Okay, thank you. Thank you, Dr. Uppal, for inviting me to deliver an expert lecture on the topographic anatomy of bovine abdomen in relation to clinical intervention. As we know, the bovines, they are an important part of the livestock, and the population of bovine is maximum in India. India constitutes the maximum population of bovine, which include cattle and buffalo. And India ranks first in milk production in the world. Dairying is an important profession which is a great source of income for the rural people, farmers, and it is also playing an important role for generating the income for the large group of the society. But these bovines, they suffer from the several type of ailments, and among these ailments, the ailments of abdominal organ and abdomen is the commonest one. And due to this, there is loss to the farmers, and ultimately there is loss to the nation. Whenever there is any ailment of the abdomen or the abdominal organ in the bovines, it leads to the reduction in the productive and reproductive value of the animal. Therefore, this topic has been chosen and is pertinent to be discussed in this forum. Now, as we know, there are three body cavities: the thoracic cavity, abdominal cavity, and the pelvic cavity. Among these three cavities, the abdominal cavity is the largest one. The abdominal cavity, it is separated from the thoracic cavity anteriorly by the diaphragm, but posteriorly it communicates with the pelvic cavity very freely. But there is line of demarcation between the abdominal cavity and the pelvic cavity, which is called which is called terminal line or brim of pelvis, which is formed by the body of the sacrum dorsally, laterally by the anterior iliopectineal line, and ventrally by the pubic bone. The abdomen is oval in shape and is compressed laterally, and the roof of the abdomen is formed by the lumbar vertebra, lumbar muscles, and the crura of diaphragm. The lateral wall is formed by the oblique muscles, obliquus abdominis externus, obliquus abdominis internus, transversus abdominis, and the costal cartilage of the asternal ribs, and the parts of the posterior ribs below the attachment of the diaphragm, and ilium and the iliacus muscle. The floor is formed by the two recti muscle and the aponeurosis of the oblique and transverse muscles of the abdomen and the xiphoid cartilage. Anteriorly, the anterior wall is formed by the diaphragm, which is dome shaped and is appear concave from the abdominal side. The abdominal cavity is the largest cavity of the body, and it contains the large number of the content. The contents of the abdominal cavity, they are the greater part of the digestive tract, which includes stomach. As we know that the bovines, they have the compound stomach. So it consists of rumen, reticulum, omasum, and abomasum. Small intestine, duodenum, jejunum, and ileum. Large intestine, cecum, colon, and rectum, and the rectum is the part which is present in the pelvic cavity. Beside this, the liver, pancreas, spleen, parts of internal genital organ, parts of urinary system, blood vessels, lymphatics, and nerves, and many lymphatic glands, lymph glands, they are present within the abdominal cavity. Now the common ailments of the abdomen, the many common ailments which are noticed in the abdomen, they are the blot. Blot mainly affect the rumen impaction, traumatic reticuloperitonitis, omasal impaction, abomasal displacement, abomasal impaction, intestinal obstruction due to any reason. In all these conditions, where the surgical interventions they are required, we can see the part of digestive system, the stomach is affected, rumen, reticulum, omasum, and abomasum. Another important and very common ailment which is found in bovine is the hernia. Hernia is a condition where the content of the abdominal organ, it may come out either through the natural opening or the acquired opening and is covered with the skin or the peritoneum. In the covered hernia and uncovered hernia, it is open. Now the hernia is the one of the important uh, ailment which is found in the bovine and is very common. Now, just brief about the hernia. As I told you, hernia is the passage of the organ of the abdominal cavity through a natural or acquired opening in the abdominal wall, forming a swelling covered by the skin and peritoneum. And the essentials of the hernia is the hernial ring. If there is a hernia, always the hernial ring, or it is also called as the neck of the hernia, it is formed, and the content of the hernia, that means the some content, either it may be intestine or it may be stomach or any other part, it may comes out, that is called as the content of the hernia. And the hernial sac, so the sac which is formed, which is formed by the skin, subcutis and the peritoneum. Now, the common types of hernia which are noticed, they are the umbilical hernia. Umbilical hernia is common in the very young calves. We know that the in the fetal condition, the umbilicus is present, which later get closed by the formation of the scar. Sometimes it remains very weak and the abdominal organ may come out. So it leads to umbilical hernia. So umbilical hernia, it may be reducible or irreducible. In reducible condition, the sometimes the some cloth or some drape is tied over the affected part, and with the passage of the time, the fibrosis takes place and leads to the correction of the condition. But in irreducible hernia, the surgical intervention are required. So the minor surgeries is done to reduce the content and the suturing is done. Next is the inguinal hernia. Inguinal hernia, as we know, there is a inguinal canal in the wall of the abdominal cavity. So through this opening, sometimes the intestine, it comes into the inguinal canal. When the content, it remained in the inguinal canal, it is called as the inguinal hernia. And when this content comes into the scrotum, this leads to the scrotal hernia. So these two hernias, they are very rare, rarely noticed in the bovines. Now the ventral hernia is mostly occur by the acquired condition. It is occurred due to the groaning of the animal. When the two animals, they fight with each other, they causes the injury in the lower part of the abdomen, in the ventral part of the abdomen, due to which there is rupture of the abdominal muscle and causes the ventral hernia. Now the perineal hernia and the diaphragmatic hernia. This diaphragmatic hernia is very common in case of the bovine, where the content of the abdominal cavity, it ruptures the diaphragm and comes into the thoracic cavity. Now, up to this, we have come to know that what are the different ailments of the abdomen and the abdominal cavity, and what for the correction of these conditions, we have to go for the surgical intervention. And before proceeding for any surgical intervention, it is important to know the topographic anatomy of the abdomen. Now, the abdomen, as the abdomen is very large and it contains the large number of the contents of the abdomen. So it is in order to perform any surgery, we must know the exact location of that organ. So for the convenience, the abdominal region is divided into 9 regions of the abdomen by the 2 sagittal and 2 transverse imaginary lines. The 2 transverse line, the first transverse line passes at the level of the first lumbar vertebra, and the second line, transverse line, passes at the level of the last lumbar vertebra. These two transverse lines, they divide the abdomen into 3 main regions: the epigastric region, mesogastric region, and the hypogastric region. Then these two sagittal lines, which passes in the middle of the inguinal ligament, they divide the abdomen into 9 regions. So in the center, the anterior one is near the xiphoid cartilage, so it is called xiphoid region. The middle one is umbilical region, and this one is the prepubic region. And the laterally, when this is the left side, so this is the left parachondriac region, this is the left lumbar region and left iliac region. Similarly, on the right side, this is the right parachondriac region, right iliac lumbar region and the right iliac region. Thus, the abdomen is divided into 9 regions to describe the specific topography of the organ present within the abdominal cavity. Now, besides this, the other terminologies which are used for topographic description, they are the sublumbar region, that means below the lumbar region where the kidney is present, then the flank region present on the in the abdominal wall, paralumbar fossa, paracostal, inguinal, mammary region, intraperitoneal, retroperitoneal. These two terminology, intraperitoneal and retroperitoneal, these are used for the organs which are present within the cavity, and then the diaphragmatic region. Now, this is the flank region. We can see this is the flank region. This is the non-osseous part of the abdomen, and it is formed dorsally by the transverse process of the lumbar vertebra, anteriorly by the last rib, and posterior boundary it extends from the tuber coccyx to the stifle joint. So this is the non-osseous part, and in the upper part of this flank region, a triangular fossa is formed, which is called as the flank region. Now, the abdomen, in the abdomen, the maximum dorsoventral diameter, which we can say the vertical axis is, it extends from the last rib to the umbilicus. And the maximum longitudinal axis, it extends from the middle of the pelvic inlet to the sternal part of the diaphragm. So this is the longest axis of the abdomen. Now come to the muscles of the abdominal region. The muscles of the abdomen, the muscles, this is the obliquus abdominis externus and this is the obliquus abdominis internus. Here the superficial muscles dissection, and here we can see this is the cutaneous trunci. This is the muscle which develops within the fascia, superficial fascia, and is a maximum developed on the ventrolateral part of the abdomen, and it extends anteriorly up to the shoulder, fascia of the shoulder, and posteriorly up to the thigh region. So this is the cutaneous trunci. Now next to this, this is the external obliquus abdominis muscle. Among all the muscles of the abdomen, this is the most extensive muscle and irregularly triangular in structure. It consists of muscular part and aponeurotic part. The muscular part, they arise as a digitation, and they arise from the lateral and posterior part of the rib. And the fibers of these muscles, they run obliquely downward and backward, and they join the aponeurosis. Now the point of origin of these muscles is indicated from the fifth rib, ventral part of the fifth rib up to the last rib, and the point of joining of muscular part with the aponeurotic part is indicated by a curve which is formed from the posterior border of the deep pectoral muscle, and this curve run up to the tuber coccyx. So this indicates the joining of the muscular part with the aponeurotic part. Now, this muscle, the fibers in the ventrolateral part, the fibers they run obliquely downward and backward, and this in the flank region they are almost straight. Now, in the about an inch anterior to the pubis and 2 inches median to the midline, the opening is present, which is called as the external inguinal ring. Actually, what happens in the aponeurotic part, it divides into two parts. The one part, it joins the tuber coccyx, another part joins the pubic. And in between these 2 points, this aponeurotic part is further strengthened. And this strengthening, which is called the inguinal ligament, This inguinal ligament is also called the Poppert's ligament, and this inguinal ligament, this inguinal ligament, it forms the posterior boundary of the inguinal canal. Now, this is the obliquus abdominis internus. It arises from the tuber coccyx and the aponeurotic part of the external obliquus abdominis muscle. It is also irregularly triangular in structure and consists of muscular part and the aponeurotic part. The major muscular part, this is present in the flank region, and in the ventrolateral part, the aponeurotic part is present, and here the internal inguinal ring is formed. Next muscle which is present, this is the transversus abdominis muscle. This muscle is also consists of fibrous part and the aponeurotic part. The maximum thickness of muscle is present along the costal cartilage, and as it moves upward and posteriorly, it becomes thin. And this is the aponeurotic part, and above also the part is aponeurotic. And the fourth muscle, which is restricted to the ventral aspect of the abdominal cavity, this is the rectus abdominis, which starts from the xiphoid cartilage up to the pubis. This muscle is, the fibers of these muscle, they are longitudinal, and in between these muscle, the transverse band of the fibrous tissue is present, which is called as the inscriptorius tendini, which provide additional strength to this muscle. Now, this muscle is thickest in the middle of the abdomen, and posteriorly it becomes thin. Now come to the diaphragm. As we know, this diaphragm, it is the musculotendinous structure. It has three parts: the costal part, which attaches with the ribs, then sternal part, which attaches with the sternum, and the crura of diaphragm. And within the abdominal cavity, the three main apertures, they are present: the foramen vena cava, through which the foramen vena cava passes, then hiatus esophagi, through which the esophagus passes, and the hiatus aorticus, through which the aorta passes. So this diaphragm, this is musculotendinous structure. The muscular at the periphery, at the costal part is basically muscular, and in the center it is tendinous, and this is the musculotendinous junction. This is the musculotendinous junction. Now the various openings, they are present. Foramen vena cava opening is present at the level of the 8th thoracic vertebra. Esophageal opening is present at the level of 10th thoracic vertebra, and hiatus aorticus is present at the 12th thoracic vertebra. The location, the topography of these openings are very important to know before performing any operation on the abdomen, because through these opening, the caval opening and the hiatus aorta, these are the main blood vessels of the body, and the surgeon should keep in mind while performing any surgery that what is the location of these vessels. Now, in the abdomen, in the mid ventral part, linea alba is formed. Actually, what is this linea alba? It is a white fibrous raphe which extends from the xiphoid cartilage to the pubis. And this linea alba is formed by the aponeurotic part of the oblique abdominal muscles and the aponeurotic part of the transverse abdominis muscle of either side. The aponeurotic part of the muscles of the either side, they join in the middle or in the middle ventral part of the abdomen and leads to the formation of linea alba. The importance of this linea alba is that because this is purely fibrous and the blood supply is less, and the rectus sheath. Now here the aponeurosis, this is the aponeurosis where all these three muscles, they are involved: transversus abdominis, internal abdominis obliquus, and external abdominal obliquus. Now this the external obliquus abdominis externus, it forms the external sheet over the rectus muscle, and therefore it is called as the external rectal sheet. Now the transversus abdominis, it forms a sheet on the inner side of the rectus muscle. So it is called as the inner rectal sheet. When these two rectal sheets, they join in the center at the linea alba. So this linea alba is formed by this aponeurotic part of the oblique muscle and the transverse muscle of the abdomen. Now, the most important thing, the content of the abdomen. The topography of the various organs which are present in the abdomen, these are very important to know. When we open the abdomen from the left side, the various organs which we can see, they are the rumen. We know that in the bovines, the stomach is compound stomach, and it is having four compartments: rumen, reticulum, omasum, and ovimusum. The whole stomach occupies 3/4 part of the stomach. That means the rumen occupies whole of the left half of the abdominal cavity and extend over the median plane and on the right side. So when we open the abdominal cavity, what we can see, the rumen. So the rumen is the largest organ which is present on the left half of the abdominal cavity, and it occupies almost whole of the left half of the abdominal cavity. The longitudinal axis of the rumen, it extends from the seventh or eighth intercostal space to the pelvic inlet. So this is the longitudinal axis of the rumen. Anteriorly, the blind sac is present. Posteriorly, the dorsal and ventral blind sacs of the rumen, they are present. So this rumen occupies the major part of the left half of the abdominal cavity. In the anteriorly, this reticulum. The reticulum is the most anterior and smallest part among the four divisions of the stomach, and it is present anteriorly, and it lies at the ventral part of the sixth to eighth rib. As I told you, the diaphragm is dome shaped, and due to this dome shaped structure of the diaphragm, the size of the abdominal cavity increases at the expense of the thoracic cavity. So the reticulum lies opposite to the sixth to seventh to eighth rib at the ventral part. Now the spleen is present on the right side. Spleen, it is present on the dorsal surface of the rumen, and its upper extremity lies below the last two rib, and lower extremity lie at the level of eighth and ninth rib. So on the left side, we can see these abdominal organ, and very rarely few coils of small intestine may be seen on the left part of the abdominal cavity, when the left part of the abdominal cavity. Now, when we observe after dissecting on the right side, the various organs which we can see in the abdominal cavity, this is the liver. So the liver is the largest gland of the body, and it is present in the paracontriac region, immediately behind the diaphragm. And its longitudinal axis extends from the, means dorsal extremity lies below the last rib and extends up to the transverse process of first and second lumbar vertebra and lower extremity. It runs obliquely downward and forward parallel to the median plane. Now up to the xiphoid cartilage. And behind this, this is the omasum. So omasum is present on the right of the right side of the median plane, and it lies opposite to 7th to 11th rib. 7th to 11th rib, and it is ellipsoidal in shape. Abomasum, this is the abomasum, it is elongated in shape, and its most anterior part, called fundus of the abomasum, it is present almost in the median plane near the xiphoid cartilage. Then the body of the abomasum takes a turns towards the right side, run on the floor of the abdominal cavity, and then it inclines upward to form the pyloric part. So this pyloric part of the abomasum joins the first part of the small intestine, that is the duodenum, at the pyloric end. Now this pyloric end is present. This pyloric end is present at the level of 9th and 10th rib. Now this abomasum, it occupies the floor of the abdominal cavity in its anterior part. Now the first part of the small intestine, the duodenum start at the level of 10th rib or 9th intercostal space. It runs upward, forward, at the visceral surface of the liver, where it forms a S-shaped curve called ansa sigmoidea.
Ma'am, you have muted yourself. Please unmute, ma'am. Archana, ma'am, you have muted yourself. Please unmute yourself.
Is it okay? Okay. Now the second part, it runs backward and reaches up to the tuber coccyx, where it forms the iliac flexor and then takes a turn forward. This is the third part of the duodenum. It runs forward up to the up to the first lumbar vertebra and joins the mesenteric part of the small intestine, which is formed by the jejunum and ileum. So the jejunum, this is the most coiled part of the small intestine, and it occupies most of the floor of the abdominal cavity. And then the terminal straight part, this is the ileum, it inclines upward to join the cecum. So the cecum is the first part of the large intestine, and its blind end is present at the level of the pelvic inlet. Anteriorly, it continues with the colon, and so here the ileocecal opening is present, and then cecocolic opening is present. Then the colon, in case of bovine, it is present in the form of the coil, and this coil is formed, and then it comes and then it takes a turn and runs from the straight part, terminal part of the colon to join the rectum. The rectum has again the two part, ampulated part and the straight part. So what we want to say that on the right side, the different organs which we can approach, they are the omasum, abomasum, the intestine, whole of the intestine occupy the right side of the abdominal cavity. So any operation which we want to perform on the intestine, whether it is on the large intestine or small intestine, we have to approach it from the right side. The colon is present in the dorsal part of the abdominal cavity, whereas the small intestine, the jejunal part, occupy the floor of the abdominal cavity. And this abomasum occupy the anterior part of the floor of the abdominal cavity. In addition to this, the kidneys, they are also present in the abdominal cavity. This right kidney, which is also called as the fixed, it is always fixed in position, and it lies below the last two rib, and extend up to the first and second transverse process of first and second lumbar vertebra. The anterior extremity of the right kidney is present in the fossa of the liver. So it is called as the renal fossa. Now, the left kidney is the floating kidney. It is mobile and its movement depends upon the fullness of the rumen. And most when the rumen is full, it is found on the right side of the abdominal cavity, below and behind the right kidney. And then the urinary bladder. This urinary bladder is present at the level of the pelvic inlet in the abdominal cavity. Now, when we open the abdomen from the ventral aspect, the different organs which we can see, they are the rumen. So you can say the rumen, when it is full, it comes on the, it also occupy the right side of the abdominal cavity. This is the left side of the abdominal cavity, and part of it is coming on the right side of the abdominal cavity also. These are the coils of jejunum, and this is the abomasum, this is the liver, and this is the reticulum present opposite to the 6th to 8th rib. Now the various surgical interventions which, so this is the normal topography of the organs of the abdomen, and whenever there is any disturbance in their position or in their physiology, we have to go for the surgical intervention. So the surgical intervention which we go, they are the exploratory laparotomy, rheumatology, treatment of abdominal displacement, surgery of intestine, cesarean section, abdominal approach for the diaphragmatic hernia, repair of rupture of urinary bladder, and ovarectomy. So see, there are the different surgical intervention which are required for the correction of abdominal ailments. Now, the common surgical site which you use for the abdominal surgery, most of this time, in case of the large animal, flank incision is used. So the flank incision, it may be lower flank or it may be upper flank. Upper flank incision, it may be used on the right side or on the left side, depending upon the organ which we want to approach. For example, the left upper flank incision is given for the approach of rumen, reticulum, spleen, and urinary bladder, and the right upper flank incision is given to approach abomasum, small intestine, large intestine, liver, and gallbladder, and also the urinary bladder can approach from the right side also. Lower flank incision, it is also called ventrolateral incision, and it is used to approach mostly the gravid uterus or for the cesarean section. So these are the different incision. This is the upper flank incision, lower flank incision, and this is the ventrolateral incision. These are the some other incision. This is the midline incision, which is totally contraindicated in the bovines, because in case of bovine, the weight of the abdominal organ is too much. So it is not advisable to give the midline incision. Usually the paramedian incision is given for the cesarean section. Otherwise, the incision is preferred in the flank region. And the paracostal incision is also sometimes very rarely required in the bovine. Now, for performing any surgery, it is very important that there should not be any pain. And to reduce the pain, it is important to give the anesthesia. And for giving the anesthesia, we have to go for the block, the paravertebral nerve block. So, in the abdominal region, the major nerve, which is nerve supply, is by the last thoracic T13, L1, and L2. L3 is partially, but it because as these nerve, they arise and they run backward. So mostly the T13, L1, and L2 nerve, they supply the wall of the abdominal and the abdominal organ. And this T13, L1, and L2, the usually the paravertebral anesthesia is preferred. Now, here we can see the root, dorsal root arise and the ventral root arise, and then here the ganglia is formed, and then the spinal nerve. This is the spinal nerve, and here the dorsal branch is given. This dorsal branch goes into the longissimus, the dorsal muscles of the body, and then this is the ventral branch. And this ventral branch further divide into superficial branch and the deep branch. The superficial branch, it goes to the skin and the superficial muscle of the abdominal region, and deep branch, it goes into the deep muscle and the peritoneum of the abdominal region. So most of the time when we are going to perform any operation, and we for the flank and approaching from the flank side, so usually we give the incision at the paravertebral block is given, so that the ventral branch is mostly anesthetized. So this is all about the various topography and what are the how the nerve blocks they are given. Now come to the diaphragmatic hernia. As I told you, it is the one of the most important and the common and the common disease in the bovine, and it causes lot of loss to the farmers. And whenever the animal is affected by the diaphragmatic hernia, animals stop eating food. It becomes weak and unable to do any work. So the diaphragmatic hernia, why this happens in the bovine? The bovine, actually, for the causation of diaphragmatic hernia, the topographic location, this topographic location of the abdominal organ, that means the reticulum and the heart, is very important. Now here we can see the heart, it lies second to opposite to the second to sixth rib, and reticulum lies opposite to the sixth to eighth rib. And in between these, here we can visualize very easily, this is the reticulum lying against the diaphragm. So this is the diaphragm. This is the diaphragm. And here the heart is present in the thoracic cavity, and it extends from the second to sixth rib. So another one is the reticular groove. This is the reticular groove. So this reticular groove, whenever the animal eat any metallic object or any sharp object, it directly fall into the reticulum. And due to the interior structure of the reticulum is honeycomb shape. So these metallic object, sharp object, and they are entrapped in this reticulum. So this reticulum, whenever the sharp object it falls into the reticulum, it start pricking the wall of the rumen. And another point is also the anterior extremity, the reticular extremity, they are also called reticular extremity. Here a rounded cul-de-sac is formed, which lies at the sternal part of the diaphragm, and it is in contact with the liver, omasum, and abomasum. So these are the anatomical structures which due to which the cases of diaphragmatic hernia are more common in the bovine. And this reticulum, when the organ now this sharp object, this start picking. Now this जो ये reticulum है, it lies at the musculotendinous junction of the diaphragm also. So musculotendinous junction, it is the weak point. So whenever any sharp object, it comes into the reticulum, it start penetrating the wall of the reticulum, leads to rupturing of the wall of the reticulum, causes traumatic reticulitis. And if the condition continues, it ruptures the peritoneum. So it leads to the traumatic reticuloperitonitis. And then ultimately it ruptures the diaphragm. It ruptures the diaphragm and enters into the thoracic cavity. And immediately as it enters into the thoracic, next organ is heart. So the heart is penetrated by the sharp object. First of all, the heart, the pericardium. So the pericardium ruptures, so it leads to the traumatic reticuloperitonitis at pericarditis. And finally, the heart is ruptured. It's not necessary that it always rupture or penetrate the heart. It is the anatomical location of the heart that most of the time heart is affected, but sometimes the sharp object, it may enter and it may rupture to the lungs also. There are several cases where where the sharp object, it may enter from the reticulum after rupturing the diaphragm into the lungs also. But here we are talking about the diaphragmatic hernia. So it is diaphragmatic hernia. Here the diaphragm is ruptured and the organ come into the thoracic cavity from the abdomen. And this is the condition. This is the condition where we can see this is the reticulum. This is from the thoracic cavity side, and this is the part of the reticulum which enters into the thoracic cavity. And there the hernial ring is formed. It is the hernial ring. So this is a hernial ring. This is the content. Content is reticulum, and this sac is. But here the sac is not formed because here it is not covered by the skin or the peritoneum. It is uncovered type of the diaphragmatic hernia. Now it is another condition. Here the reticulum comes and is pressing the heart. Reticulum, it has ruptured the diaphragm. Here the hernial ring is formed and it comes into the thoracic cavity and pressing the heart. This is the reticulum. The interior of the reticulum, this is hernial ring. And this reticular groove is badly distorted due to the sharp object. This is the diaphragmatic hernia. So so we can conclude that the abdominal ailments, there are several abdominal ailments, they affect the bovine. And for the correction of these ailments, the surgical interventions which are required, for that it is very important to know the anatomy of the abdominal cavity. And among these ailments, the hernia is most common. And hernia, the causation of hernia is uh, maximum common in bovine because of the topographic location of the various organ present in the thoracic cavity and in the abdominal cavity. Thank you.
Thank you very much, ma'am, for enlightening us on this very important topic. And your talk has been so clear that only few queries has come. One of the query which is more related to the surgical aspect than the anatomy, still I put to you if you can take it up. One of our students has asked how long it takes for the abdominal muscles to heal after the surgery. So it's maybe as
It depends because usually the abdominal healing occurs within a week time. It takes very less time, and it depends upon the condition of the patient. In the young animal, the regeneration of muscle is very fast, so the healing is very fast in the young animal, and in the older animals, the healing is slow. So it vary from the healing of the muscle depends upon the age, nutrition, and the season also.
Ma'am, one question has come. Can the diaphragmatic hernia noticed from so half question we omit this. Which abdominal muscles will come through while doing ruminotomy?
Ruminotomy, for performing the ruminotomy, as I told you, the rumen is present on the left side of the abdominal cavity. So we approach it from the left side. So the incision is given in the paralumbar fossa. So I showed you the various muscle which are present in the upper flank region में देंगे. The incision is given in the upper flank region. So upper flank region में the various muscles, they are the mainly the external obliquus abdominis, internal obliquus abdominis is the main one, and the aponeurotic part of the transverse abdominis muscle. They are present at the upper flank region.
Ma'am, one of our participant has asked whether these conditions, clinical conditions, are related to the breed. Is there any predilection associated with the breed, particularly endogenous versus the exotic breeds?
Uh, Actually, the topic was the topographic anatomy, and it is the. But I have gone several paper, so I have not come across any paper in which breed wise there was study. But however, it was the most of the cases they are reported in the cattle and the buffalo without mentioning the breed. So I can say the diaphragmatic hernia is a disease of both the animals, buffalo as well as cow, and at both the species of the animal, but I cannot say about the breed of the animal.
Okay, thank you, ma'am. Ma'am, one of our participants has put a query. Can the diaphragmatic hernia be noticed from seeing the externally to the animal?
Diaphragmatic hernia, actually externally clinical symptoms which has been shown by the animal, like it feels difficulty in walking because the reticulum, I told you the position of the reticulum is opposite to the 6th to 8th rib, and you know the forelimb is also present at that level. So animal feel difficulty in walking, but externally we cannot see any uh, mm, uh, appearance. It can be done by the diagnosis can be made by radiography and exploratory laparotomy.
Okay, ma'am. I think we have no more queries. In that case, thank you very much, ma'am. And I request Dr. Neelam Bansal, madam, to please put a vote of thanks to the speaker and also to the participants. Madam Bansal, please.
Thank you, Dr. Patel. It is a matter of great privilege for me to thank all of you on the behalf of organizing team of the webinar. First of all, I thank Dr. Archana Pathak, Professor, Department of Veterinary Anatomy, GADVASU, Mathura, for giving very informative and motivative lecture of the clinical importance on the topic topographic anatomy of the bovine abdomen in relation to surgical interventions. This lecture will be very useful for all the veterinarians working in various institutes and state government. Thank you, ma'am. I also extend my gratitude and thanks to Honorable Vice Chancellor, sir, Dr. Inderjeet Singh, and Dr. S.P.S. Kumar, Dean College of Veterinary Science and PI of IDP, for giving us an opportunity to organize this webinar. So participants are very important part of the webinar. Almost 300 participants attended the webinar. So I thank all the participants who have attended to this webinar. Then I thank all of you who have attended the seminar. Thank you. Thank you all.
Thank you, Madam. Dr. Pathak, I also want to express my gratitude to the organizers and the organizing committee for giving me this opportunity to deliver the lecture. Thank you very much. आवाज नहीं आई, अनम्यूट करो.
Thank you very much, ma'am, for enlightening us on this very important topic. And I hope all our participants would have enjoyed it. And I guess they have enjoyed, and that's why they have put a lot of queries to you. And every queries was addressed by you. Thank you so much, ma'am, once again for accepting our invitation and talking to our participants. Thank you very much, ma'am.
Thank you.